Hi, I'm Scott Green, and I'm a plastic surgeon at the Plastic Surgery Center in Sacramento. This is Stacy Lassiter. She is our physician's assistant, and both of us help take care of you during your surgical procedures. She's important in your pre- and post-op care. I'm important in your surgery care and some of your pre- and post-op care as well. So we're both responsible for seeing you through this surgical procedure and helping you get the optimal outcome. Today, we're going to talk about brachioplasty. Brachioplasty is kind of a strange word that describes an upper arm lift. And so what that means typically is liposuctioning of your arm and removing excess skin from the upper arm. There's different ways to do brachioplasty, but I really only do it one main way, and that is through an incision on the inside edge of your arm right here, not behind your arm, not on top, but right on this inside area of your arm and in your armpit. That incision allows us to remove maximal skin from that area, really almost an infinite amount of skin from that area, and also allows us to remove fatty tissue. Additionally, while we are doing a brachioplasty, we typically do liposuction at the same time. The obvious downsides of this surgery are the scar, and that's one of the first things I talk about whenever somebody comes in to see me for a consultation about brachioplasty is, hey, there's a scar on the inside of the arm when we do that surgery. Are you sure what bothers you is worth the scar? And so that's the first thing you really need to sort of tackle or come to grips with is the scar okay? Unlike some of our other scars that hide very well, like a breast implant scar or a tummy tuck scar that's under clothes the whole time, much of the reason somebody comes in to see us for brachioplasties is they want to wear a short sleeve shirt. They want to be able to see their arms. They want to be able to wear a tank top. And when we have a scar there, that is a little bit of a bummer that we can't make that scar totally hide. People ask about, can't we just do this surgery through my armpit so that the skin all gets pulled up into my armpit? And the answer is, there are people who have described doing that surgery that way. My honest opinion, it doesn't work very well. I've watched it, I've tried it, I've seen people's results, and I've never seen anything that I thought really looked great. And there's certainly not any way to do it through the armpit when we have real significant skin in the arm to get rid of. There's just no way to accomplish it. So suffice it to say, the best way to do the surgery 99% of the time is through the incision that I described. So if you're considering brachioplasty, just know that that's the incision you'll have. Now, in some people that incision heals great, and in some people, honestly, it doesn't heal great. What makes it not heal great? Well, a couple of things. One, the skin on the inside of our arm is really thin. If you pinch it, you'll see it's not much thicker than eyelid skin, so it doesn't have a lot of strength. That's one thing. And what happens because it doesn't have a lot of strength is it heals slower. And because it heals slower, that tension pulls on that incision, and your body chemically recognizes that the incision is coming apart a little bit, and so it sends a whole bunch more of these cells called fibroblasts and myofibroblasts in there to try and hold the incision in place, and those little cells produce collagen. And sometimes they don't know when to stop, and they produce excess collagen, more than you really needed to hold it together, and enough that it creates a scar that can be noticeable, even sometimes thicker or keloided in some circumstances. So that's one of the main complications of brachioplasty is the scar not healing as well as we hope. And so that's something to think about. Can we fix that if that occurs? The answer is much of the time, but it means a second surgery. It means going back and revising that scar and then usually injecting it with a medication like a steroid to try and treat that. The other things we think about in a brachioplasty is afterwards you're going to have some specific restrictions, one of which would be bending your arms a whole lot because that can put extra stress on that incision, picking heavy things up, doing strenuous work, or even something as simple as reaching up into your cabinet. Reaching this high is going to put stress on that incision that's in the armpit and going to potentially cause your incision not to heal well in that area, giving you a wound in your armpit that can take a month or two to heal. It will eventually heal, and if this occurs, it's not the end of the world. We can fix it, but it can take a while to heal perfectly for you, so you have to follow our recommendations post-op very carefully. Additionally, doing an arm surgery can create some swelling in your arm, not just in your arm, but down in your forearm and even in your hand. That swelling is lymphatic fluid, and that lymphatic fluid has to travel upstream up our arm to get back to our heart. That problem with taking out some of the tissue from our upper arm can obstruct or block some of that lymphatic fluid flow that's normal. And it takes a while for our body to build new channels to fix that. And so therefore, some mild swelling in your forearm and hand are relatively common for the first month or two after surgery. Because of that, we have you wear a compression garment over your arm from your base of your forearm all the way up to your armpit for the first month or so. Usually after the first few days, where we put just ace wraps on your arms, we have you go get a compression sleeve. You can use runner's sleeves or other compression garments to do this, and they work very well. But it does cause a little bit of tension and discomfort in your arm when that swelling's there, so that's something that's important to know. That's most of brachioplasty. There's not a lot else to it. It's a relatively simple surgery, not a super painful surgery. The skin's a little ouchy in that area. If you pinch your inside of your arm, you'll see it's a little ouchy. So patients do take pain medicine for a couple of days. The whole surgery takes about 2 hours. You're with us for about 4 hours total in surgery. You go home. We're happy if you're up moving around, doing stuff, just no strenuous stuff. No weightlifting or going to the gym and doing strenuous activities. Try to avoid bending your arms. Keep them a little bit elevated, but not too elevated. You want to keep that arm below 90 degrees so we don't put tension on that armpit. So if you got to get stuff out of your high cabinets, get on a chair or ask somebody to help you with that. A brachioplasty, like all of our surgeries, is we have somebody stay with you. A surgery that we have somebody stay with you for the first 24 hours, but after that you're pretty well able to do everything on your own. Even in the first few hours after surgery, most people are able to get up, move around, watch TV, and do everything pretty comfortably. So it's a pretty straightforward, simple surgery, simple recovery, and can fix a problem that has bothered people for a long, long time. Most people are very happy with brachioplasty when they choose to do that. Once they kind of get past the idea of the scar and they say, hey, I can wear any blouse I want now, any shirt I want now, I don't have to worry about my arms or excess skin in that area. So it's usually something people are very happy with. Hope this answered most of your questions. When you come see us in person, we'll try to answer any question you have. And that's it. That's your brachioplasty consult.